What if I told you that something you do 3 times a day, something so ordinary you don't even think about it, is quietly pushing your blood pressure higher every single hour? And what if I told you that stopping it, not forever, just for 14 days, could drop your systolic blood pressure by 8 to 10 points without a single new medication? You might not believe me, most people don't. And honestly, most of the advice you've been given about salt and blood pressure has been incomplete or flat out wrong. I'm Dr. Frank Briggs. I spent 20 years as a family physician before retiring at 67. I've sat across the examination table from thousands of patients in their 60s, 70s, and 80s, and I've watched them do everything right, take their pills, walk every morning, eat their salads, and still walk back in with blood pressure that refused to budge. Today, I'm going to show you exactly what happens to your cardiovascular system, your arteries, your kidneys, your heart, when you remove excess sodium for just 14 days. 7 specific, measurable changes. And at the end, I'm going to give you a protocol you can start tonight. Stay with me, because what I'm going to share in about 6 minutes changes everything most people assume about this topic. Now, before we go further, I want to speak directly to you if you are between 60 and 85 years old, because blood pressure is not a one-size-fits-all problem. What's happening in your arteries at 68 is biologically different from what's happening in 40-year-olds' arteries. After 60, your arterial walls become stiffer, a process called arteriosclerosis. Your kidneys become less efficient at flushing sodium, and your renin-angiotensin system, the hormonal network that regulates blood pressure, starts responding more strongly to salt. This means sodium hits you harder, faster, and more persistently than it did 20 years ago. The good news, that same sensitivity works in reverse. When you reduce sodium, your blood pressure responds more dramatically and more quickly than it would in a younger person. Your body is actually primed to respond. You are not broken. Your system is just waiting for the right signal. I practiced family medicine for 2 decades in a mid-sized community clinic. Over half my patient panel was over 60. High blood pressure, what we call hypertension, was the single most common diagnosis I managed every single day. And what I observed in the exam room does not always match what appears in the standard guidelines handed to patients. The guidelines say reduce sodium, but they rarely explain the mechanism, the step-by-step biology that makes reduction actually work. And without understanding the mechanism, most people don't sustain the behavior. So today, I'm going to walk you through the 7 measurable changes that happen inside your body when you remove excess salt for 14 days, backed by published research from institutions including the New England Journal of Medicine, JAMA, and the American Heart Association. Charlene Dorsey was 68 years old, recently retired, and by most external measures doing everything right. She walked 3 mornings a week. She had eliminated fast food years ago. She took her lisinopril every morning like clockwork. And every time she came into my office, she looked at me with the same expression, a mixture of frustration and resignation, because her blood pressure sat stubbornly at 148/92. She had been told to cut back on salt. So she had stopped using the salt shaker. She had switched to low-sodium soup. She felt she was doing everything she was supposed to do. What nobody had ever told Charlene, and what I myself had failed to explain clearly enough, was that the salt shaker is responsible for only about 11% of our daily sodium intake. The other 89% is hidden inside processed foods, restaurant meals, bread, deli meat, canned goods, and condiments. When we finally did a genuine 14-day sodium elimination trial, tracking her food labels, cooking from scratch, avoiding all restaurant food, her blood pressure came down to 134/82 within 12 days. Not perfect, but a shift her medication alone had never produced in 3 years. Charlene's lesson became the lesson I now share with every patient over 60.
The salt shaker is the decoy. The real sodium is hiding in plain sight. Before we count down the 7 changes, you need to understand the mechanism, because once you understand this, reducing sodium stops feeling like a sacrifice and starts feeling like common sense. Sodium is an electrolyte. Your body requires it for nerve signals, muscle contraction, and fluid regulation. The problem is not sodium itself. The problem is volume. When sodium concentration in your blood rises, your body responds by pulling water into your bloodstream to dilute it. More fluid in a closed system means higher pressure, like pumping more air into a tire that was already full.
Your kidneys, which are your primary sodium filtering organs, normally correct this within hours unless they are working against a consistently high intake day after day, year after year. After 60, kidney filtration efficiency declines by roughly 1% per year. So by 68, your kidneys are filtering sodium the way a drain handles the flood after a thunderstorm, working hard but lagging behind. Before I give you the full list, I want to ask you something, and I'd really love to see your answer in the comments below. What was the last blood pressure reading you remember? Just the top number, your systolic. Type it right now, even if it was years ago, even if it scared you. I read every single comment, and your number helps me understand exactly who I'm making these videos for. Now, here are the 7 things that happens when the flood finally stops. Most people expect sodium reduction to take weeks. It doesn't. Within 48 hours of dropping your daily sodium below 1,500 milligrams, your kidneys begin excreting the sodium they've been holding. And when sodium leaves, water follows. Your circulating blood volume decreases, not dangerously, but measurably. The result? Less fluid pressure against your arterial walls. A 2021 study in the journal Hypertension found that sodium-sensitive individuals, a category that includes the majority of adults over 60, showed measurable blood pressure reductions within 36 to 48 hours of sodium restriction. Your body does not wait 2 weeks to start responding. It starts tonight. Here is something your cardiologist may not have mentioned. Chronic high sodium intake doesn't just raise blood pressure, it physically stiffens your arterial walls. Sodium triggers a process called endothelial dysfunction, where the cells lining your arteries become inflamed and lose elasticity. Researchers at Johns Hopkins published findings showing that sustained sodium reduction over 14 days measurably improved what's called pulse wave velocity, a direct measure of arterial stiffness. Your arteries, which have been tightening for years, begin to soften and flex the way they're supposed to. That elasticity is what protects you from stroke and from sudden pressure spikes during exertion. This is the change most videos skip over, and it is arguably the most important one for people in your age group. Your kidneys regulate blood pressure through a hormonal cascade called the renin-angiotensin-aldosterone system, or RAAS. When sodium intake is chronically high, this system upregulates, meaning it becomes hyperactive, chronically signaling your blood vessels to constrict and your body to retain more fluid. Over years, this leads to what cardiologists call neurohormonal remodeling. Essentially, your blood pressure management system gets rewired toward high pressure as its new normal. Within 10 to 14 days of sodium reduction, RAAS activity begins to downregulate. The hormonal rewiring starts to reverse. And here is the clinical significance. If you are on an ACE inhibitor or an ARB medication like lisinopril, losartan, or ramipril, those drugs work by blocking the exact same pathway. Sodium reduction makes those drugs work better. This is not theoretical. This is established pharmacology. Now here is the one that surprises people the most, and it actually runs counter to a fear I hear constantly from patients. The worry,
Many patients fear that lowering their blood pressure will reduce blood flow to their brain, causing fatigue, lightheadedness, or cognitive fog. The counterintuitive truth: chronic high blood pressure doesn't deliver more blood to the brain. It damages the small vessels that carry it there. A 2020 study in JAMA Neurology found that hypertensive patients who reduced sodium intake over 2 weeks showed improved cerebral microvascular function, not reduced brain flow, but cleaner, more efficient delivery. Less pressure on the pipes means the pipes themselves get healthier. Think of your blood supply as a garden hose. High blood pressure is not more water. It is the same water at a pressure that cracks the fittings. When you lower the pressure, the water still gets through. The fittings just stop cracking. Every beat of your heart is a muscular contraction pumping blood through a pressurized system. When that system runs at a higher pressure, your heart must work harder. Not occasionally, not during exercise, but 100,000 times per day, every day, for years. This chronic overload causes the left ventricle, the heart's main pumping chamber, to thicken and stiffen in a process called left ventricular hypertrophy. It is one of the strongest predictors of heart failure in adults over 65. Published research from the Framingham Heart Study demonstrated that even modest, sustained blood pressure reductions of 5 to 8 millimeters of mercury were associated with a 14% reduction in heart failure risk over time.
When your sodium drops and your pressure follows, your heart doesn't have to punch through resistance with every beat. Within 14 days, myocardial oxygen demand decreases. Your heart is literally working less hard to do the same job. Sodium doesn't just raise blood pressure mechanically, it triggers systemic inflammation. A high sodium diet activates a transcription factor called NF-kappa B, a molecular switch that turns on inflammatory genes throughout the body. The result is elevated levels of C-reactive protein, interleukin-6, and other inflammatory markers that your doctor can measure on a standard blood panel. A clinical trial published in the American Journal of Hypertension showed that after 14 days of controlled sodium reduction, participants showed statistically significant reductions in serum CRP, a key inflammatory marker linked to both heart disease and cognitive decline. This is relevant to you because inflammation is not just a heart disease risk. It is directly linked to joint pain, fatigue, and the kind of systemic low-grade inflammation that makes aging feel harder than it needs to. I want to pause for a second. Have you or someone you know tried reducing salt and either it worked or it didn't? Tell me in the comments. I want to know, did you notice a difference? Did your doctor say anything? Did you find hidden sodium that surprised you? Your story might be exactly what someone else watching right now needs to hear. This is the one most patients and many physicians overlook entirely. If you are currently taking antihypertensive medication and your blood pressure is still elevated, there is a very specific reason that may have nothing to do with the drug's potency. High sodium intake actively counteracts the mechanism of multiple blood pressure medications. ACE inhibitors and ARBs work by blocking angiotensin, a hormone that constricts blood vessels and tells kidneys to hold sodium. But if you are consuming 3,500 to 4,500 milligrams of sodium per day, which is the American average, you are constantly re-triggering the same angiotensin pathway your medication is trying to suppress. You are fighting the drug with your diet every single meal. A landmark paper in NEJM found that patients on ARB therapy who also completed a 14-day low-sodium protocol achieved blood pressure reductions nearly double those on medication alone. The drug did not change. The dose did not change. The sodium changed. Your medication may not be failing you. Your sodium intake may be fighting it. Here is exactly how I would structure this if you were sitting in my office right now.
This is not a forever diet. It is a 14-day diagnostic and therapeutic window. Set your daily target: 1,500 milligrams or less. The American Heart Association defines this as the ideal target for adults with high blood pressure. The average American currently consumes 3,400 milligrams per day. Eliminate the 4 sodium landmines. Bread. Yes, 2 slices can contain 400 milligrams. Canned soups, deli meats, and restaurant sauces. These 4 categories account for the majority of hidden sodium in the typical American diet. Read every label. Look at milligrams of sodium per serving, not percentage. Anything over 200 milligrams per serving is high. A low sodium label, by FDA definition, means 140 milligrams or less per serving. Cook from scratch for 14 days. You do not need to be a chef. Baked salmon, roasted vegetables, rice, eggs, fresh fruit. These are naturally low sodium and require minimal preparation. Hydrate properly. Drink 6 to 8 glasses of water daily. Your kidneys need fluid to excrete the sodium they are now releasing. Dehydration slows the process. Potassium is your partner. Bananas, sweet potatoes, spinach, and avocado contain potassium, the mineral that works in direct opposition to sodium's pressure-raising effects. A diet higher in potassium amplifies the blood pressure benefit of sodium reduction. Measure your blood pressure daily. Morning, before eating, after sitting quietly for 5 minutes, record it. You will see the pattern shift within days 5 through 10. That data will be more motivating than anything I can say. Here are 3 reasons why people don't try this. Objection 1. My doctor never mentioned this, so it probably doesn't matter that much. Your doctor manages dozens of patients a day. Dietary counseling is often the first thing that gets compressed in a 15-minute appointment. The absence of a specific conversation about sodium reduction does not mean it is not effective. The clinical evidence is robust and consistent across decades of research. This is not a fringe recommendation. It is the first-line non-pharmacological intervention in every major hypertension guideline. Objection 2. Food will taste terrible without salt. Your salt perception is a trained response, not a fixed biological need. Taste receptors adapt to sodium levels within 7 to 10 days. Patients who complete a 14-day low-sodium trial consistently report that by day 10, food they used to eat tastes aggressively salty. You are not being asked to eat bland food forever. You are being asked to let your palate recalibrate. Herbs, citrus, vinegar, garlic, and spices are not consolation prizes. They are a genuinely different and more complex flavor vocabulary.
Objection 3. I'm already on medication. This probably won't make a difference. This is exactly the opposite of the truth. As we covered in Change 7, high sodium intake actively fights your medication's mechanism. If you are on blood pressure medication and your numbers are still above target, sodium reduction is not a footnote. It may be the missing piece. Discuss any significant dietary changes with your physician, particularly if you're on diuretics, as they affect potassium and fluid balance. I want to say something I did not say enough when I was practicing. If your blood pressure has been high for years, if you've tried and it keeps climbing or it won't budge, you are not broken. Your body is not defective. You are not someone who is simply destined to be on more and more medication. What is far more likely is this: you have been given incomplete information in incomplete conversations. You have been handed a salt shaker warning when the real problem was inside a loaf of bread. You have been given a drug to fight a biochemical battle that your diet is still waging from the other side. Your cardiovascular system, even at 68, even at 75, even at 82, retain significant adaptive capacity. The research is unambiguous on this point. Your arteries can still improve their elasticity. Your kidneys can still recalibrate their hormonal signaling. Your heart can still reduce its workload. That is not motivational language. That is cell biology. You are not someone things are happening to. You are someone who can make things happen. And the 14 days in front of you are not a sacrifice. They are an experiment, and the data from that experiment belongs to you. Take it to your doctor. Use it. The body you have today is not the ceiling. It is the starting point. If this video gave you something useful, if even one of those 7 changes made you think differently about what's happening inside your body, do one thing right now. Hit the like button. It tells me this is the kind of content that's worth making, and it gets this information in front of other people who need it exactly as much as you did. And if you are not subscribed to this channel yet, subscribe right now. I put out new videos every week on the specific biology of aging well after 60. Evidence-based, no scare tactics, just the information I spent 2 decades wishing I had more time to give my patients. I'm Dr. Frank Briggs. I'll see you in the next one.